Welcome. I'd like to review an excellent stretch that targets a whole lot of area in the spine. And the nice thing about this particular exercise, it can be done anywhere, in any place. It's safe, it's very effective. Understand that the majority of time that we spend is in a seated position. So when we're seated, we can see that the hip flexors are engaged. Therefore, the hip flexors become contracted. It allows changes to occur within the upper kinetic chain. And by sitting in this position for numerous hours, the shoulders have a tendency to go forward as the pelvic rotates backwards. As the pelvic rotates backwards, the curve, the lumbar lordosis becomes lost. It causes changes and displacement within the ligamentous structures, affecting nerves and affecting the whole neurological system. As a result of that, the muscles, which are not totally supportive because of the incorrect posture, start to fatigue. We start to slouch. And as we start to slouch, then we start developing this forward head translation, rounded shoulders, and then the whole vicious cycle continues to proceed. The end result are muscles that are not happy. The muscles are contracting. They're tired. They're fatigued. What can we do in a normal seated position when we're seated for prolonged periods of time, or we get this lot of achiness behind the neck and shoulders, maybe causing headaches or lower back area, or even into the buttocks region? Most important thing I'm going to teach you, very simple. You're going to get up. So you're going to get up, you're going to walk around a little bit, you're going to shake it off, you're going to look up into the sky, okay? You want to do things that you don't normally do, because when you're seated, you have a tendency to do what? A tendency to look down. We're not going to be seated and look up. It's not like the old days where we're in school and looking at the chalkboard all day. Now it's looking at computers. Now it's typing, writing, reading. So this particular stretch, I'm going to have you sit down like I am. I'm going to have you just bend your knees. Don't put them out like this, because you're going to get the adductor muscles. You're not going to be able to do the exercise correctly. So bend the knees. And what I'm going to have you do is I'm just going to have you lean all the way forward, just like how I am. Okay? Now, you can go ahead and cross your arms like this and just let it dangle. Okay? You're going to let it dangle. And as you let it dangle, you're going to feel a lot of stretching first in your lower back. And as you let the head down, and as long as you let everything relax, you start to feel more stretching moving upwards in the spine, between the shoulder blades and the mid-back. Now, here is the key. I like you to stretch the entire spine. So what we're going to do, we're going to grab the back of our head, both hands. Go ahead and just pull it down. Bring your chin to your chest, or hold it there. You can do that stretch as often as you like. Now, if you're doing a lot of sitting, you notice you got a lot of tightness back in here. Do that stretch. We're going to lean all the way forward. And then once we lean forward, we stretch those muscles in the lumbar and thoracic region. And then we're going to go ahead and pull behind the head. So we're going to get those erector muscles all the way stretched out throughout the whole entire spine, which is going to really loosen you up, making you feel real good. But remember, I'd like you to get up more often, take breaks every 20, 30 minutes, just for a short period of time. It will make a big difference. Look up at the sky, because we're always looking down, and just allow the body to have movement. I ask you to share this video. I ask you to subscribe, please, if you haven't, so you can continue to receive more natural, holistic healing when it comes to your health and well-being. And most important, make it a great day. I'm Dr. Alan Mandell.